Hello, my name is Dr. Robert Redfield. I'm the Chief of Transplantation at UCI Health. I'm here to talk about living donation. So what is living donation? Living donation is when a living person donates a kidney or other organ, like a liver, for transplantation. Living donors undergo an extensive evaluation to make sure they're healthy enough to donate their organ. Why consider being a living donor? Well, there are a lot of benefits to living donor kidney transplants. Really, the main three are: one, it works right away. After a living donor transplant, the kidney, once it's reperfused with blood, starts making urine typically right away. That's opposed to with deceased donors, it can take a long time, sometimes many weeks, before the kidney actually wakes up and starts producing urine. Probably even more importantly is that it lasts longer. A living donor kidney transplant is the best option that we can provide our patients who come into clinic with end-stage renal disease looking for a transplantation. On average, living donor kidney transplants last almost twice as long as deceased donors. Additionally, there's no wait, and when you have a living donor kidney transplant, we're able to schedule the surgery and perform the transplant as soon as both the donor and the recipient are ready. That's compared to having to wait upwards of 10 years on the deceased donor list waiting for a kidney transplant. And there's a lot of data out there to show that getting transplanted sooner rather than waiting on dialysis leads to longer life expectancy. As I mentioned, the wait time is quite long for a deceased donor. Currently, there are about 90,000 people waiting for a kidney in the United States. Every transplant center has a list of patients that come to the transplant center. At UCI, our list is quite large. It's about 800 patients that are waiting for a kidney transplant. As I mentioned before, the average wait time for a deceased donor kidney transplant in Southern California is about 8 to 10 years, sometimes even more. And the mortality rate waiting for a kidney on the wait list is about 5% per year. So over 8 to 10 years, the mortality rate just by waiting can be quite high. With living donors, we can bypass that wait. Surgery can be scheduled after the living donor has been approved for donation and once the recipient is approved. Additionally, it's planned. So we're able to schedule it, usually during the work week and during business hours. As opposed to deceased donor kidney transplants, they can happen at any time. And they can happen in the middle of the night, on holidays and on weekends. So it makes it less emergent with a living donor kidney transplant. More time to prepare for the transplant, can plan to schedule around work, for family, school, kids, etc. And more notice for family and support persons to help take care of both the donor and the recipient during recovery. From my perspective, all patients deserve a living donor kidney transplant. When patients come to talk to me about kidney transplant options, my wish for all of them is for them to get a living donor kidney transplant for those exact reasons that I just discussed in those previous slides. The problem is I'm not able to prescribe a living donor kidney transplant. Patients, recipients, potential recipients, have to go out to the community, to their families, and find a living donor themselves. And if you're able to find a living donor that is healthy and willing, that is able to clear the screening process, the recipient will get a living donor kidney transplant. So who can be a donor? Generally, you got to think of it as you have to be a healthy adult. All donors go through an extensive medical evaluation with the transplant team. In general, patients have to have a healthy weight, be a non-smoker, not have diabetes, and have healthy kidneys. They can be related or they cannot be related. And they don't necessarily, and this is important, they don't necessarily need to have the same blood type. At UCI, we partner with the National Kidney Registry that allows us to do kidney swaps for patients that have incompatible blood types or incompatible HLA types. So what is surgery like for the living kidney donor? We have to remove one of the kidneys, so everyone is born, most people are born with 2 kidneys. If you're going to be able to be a donor, you have to have 2 healthy kidneys. Typically we take the left kidney, occasionally we take the right. Reasons for that just depend on the anatomy, the size, the function, some recipient characteristics. It can be taken out either through an open procedure or minimally invasive procedure. At UCI, we use minimally invasive techniques, so like laparoscopic techniques and occasionally robotic techniques. There's always a chance that we'd have to convert to an open procedure. The diagram on the side shows where those X's are. That's where we make small keyhole ports. They're about a little less than an inch, where we're able to insert instruments, do the majority of the surgery, and then deliver the kidney through a small fan and steel incision. So right around the bikini line, it's just like a cesarean section, although smaller. Most donors are in the hospital for just 2 days, and the recovery is actually quite quick. After 2 days, once donors are able to eat, drink, and ambulate and tolerate oral pain medication, get off the IV fluids, and have the Foley catheter removed, they'll continue to recover at home for an additional 4 to 8 weeks. Realistically, donors start feeling very much close to normal by the 3-week mark, although there is typically some fatigue towards the end of that. We continue to monitor patients who donate here at UCI for up to 2 years after donation, and obviously are always available if any issues arise post-donation. So living donation is actually very, very safe. Part of that is because the person undergoing surgery is healthy and has been extensively screened for any comorbid diseases, bad lifestyle habits, etc. Because of that, complications are rare, but they can happen. With any surgical incision, wound infections could happen. They're quite rare. We use antibiotics and sterile solution to prevent any infections. A blood clot could occur. We do use DVT prophylaxis, so prophylaxis for deep vein thrombosis, to prevent any of those complications during the recovery period, which include subcutaneous heparin and squeezy boots on the legs. Bleeding can happen, again, very, very rare, but it is necessary that patients consent for a blood transfusion if that were to occur post-donation. A hernia where the muscles don't heal perfectly together can occur, again, quite rare, especially with the fan and steel incision. The hernia rates are quite low. Needing to go back to surgery for, say, bleeding or any other concerns can happen, but again, quite rare. During the procedure, there is a chance that we would have to convert to an open nephrectomy, which would require a bigger incision if there is any concern about the safety of the donor. As far as affecting their long-term quality of life, it's quite low. It doesn't really change much. It does, if we do have to make a larger incision, it can cause the hospital stay to be extended for a few more days for pain control. I wish I could say the risk of death is zero. It's not. It is extremely low. It's about 3 in 10,000. Very, very rare. It has happened, not here at UCI, but it has been reported in the country after donation. And that's why it's important to go to a very experienced center like ours that has a dedicated staff to screen appropriately all the patients who come forward for donation. One of the things that I'm most proud about here at UCI is that we have very extensive donor protections for our potential donors and the donors that actually move through. This comes through our partnership with the National Kidney Registry. It allows us easier processes to help reimburse lost wages for patients who need to take time off of work to be able to donate, to be able to compensate donor families for services like travel and dependent care. One of the big things is if you donate here at UCI through the National Kidney Registry, we're able to provide kidney prioritization. So in the rare instance that the remaining kidney at some point in time post-donation were to fail, we'd be able to get a living donor kidney transplant from the National Kidney Registry quite quickly. And so I think that is a really nice insurance policy that we offer our patients at UCI. So how do patients go about even starting thinking about finding a living donor? There are a lot of resources out there, but the first step is to ask. The reality is no one will offer help unless they know there is a need. And so it's very, very important that recipients think about their social network and start talking to friends, family, religious groups, co-workers, neighbors, anyone that the family or the recipient interact with. There should be a discussion about would you be willing to donate your kidney? If you're on dialysis, consider sharing what it's like. I think a lot of people don't understand the challenges that patients undergo while they're on dialysis or suffering with chronic kidney disease or end-stage renal disease. And I think sharing those stories are really, really important. I think education is really critical too. I think some patients think, why would I donate a living donor kidney when you can receive a deceased donor? I don't think people realize how long the wait is, what the difference in quality is, what the difference in life expectancy is. The reality is that living donor kidney transplantation is the best. And again, in my view, everyone deserves access to a living donor kidney transplant. One of the things that I think is really helpful is to develop a team to help spread the word, having some surrogates, if you will. It takes the pressure off of you to have to, and the burden to have to go around and talk to everyone. But I think close friends and family can be your champion, and they can talk to others on your behalf and raise awareness and let them know that you are in need of a living donor kidney transplant. In 2024, technology can be very, very helpful in this. Consider sharing your story on social media. I've seen countless patients find this to be a very, very useful way to share their story with their closest friends, families, even people you haven't seen in a very, very long time. Once they find out that you're in need, and I have seen this not too infrequently, someone from a far distant past finds out and steps up and considers living donation. Here at UCI, again through our partnership with the National Kidney Registry, we can offer microsites. These are websites that can be personalized to share your story and offer resources to potential donors. And we'll go a little bit more into that in the next slide. But just some reminders, be careful and use common sense with what you share online. Do not share any information that could allow someone to take advantage of your situation or anything like that. And to be very clear, buying and selling organs is illegal in the United States. This is kind of an example of what a microsite looks like. It's just a website. You can either have a standard site, which is very easy for you and the team here at UCI to put together, and or you can customize it further and make it more personalized if you wish. The nice thing is that donors, when they see this is something you could post on social media, Facebook, TikTok, Instagram, whatever site you use. You don't even have to use it. It could be your friends, your family could post it, your kids, anybody really. The point is trying to kind of build a marketing campaign to raise awareness that you're in need. You can also share the sites through email and put links in. They provide business cards that you can hand out. It's actually been shown to be very, very helpful. Is it a silver bullet? No, but it's something that can help get the word out. And we've seen a lot of positive impact by patients using this service. It also connects potential donors to a coach to learn more about donation, in addition to what they're going to learn through the evaluation process. And those coaches are people who actually went through the donation process and can provide advice and answer a lot of questions. And I've seen that so far be very, very helpful for potential donors. See the QR code for the microsites. If for all of our recipients who are going through evaluation and getting waitlisted, the team here at UCI will help with setting these up. Additionally, how do donors contact UCI? Here is the phone number. We have an online referral intake page, also is on the microsite, but also a separate site too, where potential donors can input their information and start the evaluation process. Additionally, it's important to note the evaluation process for donation is free, and the donors don't get charged anything. We will evaluate as many potential donors as possible to be able to get our recipients here living donor kidney transplants. And again, for those that move forward with donation, we offer a lot of support to help reduce some of the barriers to donation, taking time off of work, if there's any need with dependent care or child care. We have resources to help with that as well. And the social workers will go more in depth into all the services that can be provided. Here's some additional resources that can help. The National Kidney Foundation has some great resources, how to make the ask, and just some general information. UNOS has some great information. That's one of our governing bodies, as well. and from the National Kidney Registry as well. So this concludes the talk. I really appreciate your attention. This is a really important part of the care that we can provide here. I know there's a lot of patients who don't want to burden people with trying to ask them for a living donor kidney transplant. But as I tell my patients in the exam room, if you were my brother or sister or family member, I'd beg you to really consider a living donation. I've seen both pathways for a many number of years. Certainly, if we're able to find a living donor, that road is a lot easier and will lead to a quicker recovery, likely a longer life, and is really just the best thing that we can offer. Unfortunately, we have to go out and find a living donor, and these are some of the tools, ways to think about it. One of the things to help make that process a little easier. The entire team at UCI is committed, whether you get a living donor or not, to provide the best care possible. But whatever we can do to really try to find a living donor for you, we're committed to doing that. So thanks again, and thanks for trusting UCI with your healthcare.